hope to circulate a link to the recording in the next couple of days, so you can watch it back. So just to start us off, I suppose, just to say that, like many organizations, CES is getting to grips with this new way of working, adapting to working remotely and using new technology. And this is our first online event. It's the first time that we've done anything like this. We know that technology can sometimes be unpredictable, so please bear with us if we encounter any technical glitches. Just thank you for your patience. It's a big learning experience and learning opportunity for us, and also we'd be very interested in hearing any feedback or suggestions that you have at the end of the session. We're delighted to have three really excellent contributors here today. Anne McMurray is a leadership and organizational development consultant. Colma is the National Coordinator for Children and Young People Services Committees based in Tusla Child and Family Agency. And Vivian Gearan is a former director of the Irish Probation Service. And I'll talk to you a little bit more about them later on and before I bring them into the discussion. But I also just wanted to mention to you why CES is organising this event. So a couple of months ago, or before, in the time before this crisis, CES has been organising events, participates in and hosts networking activities, because we really see how important networking is in terms of hearing and sharing, learning and good practice. They're an opportunity for us to reflect, to pause and to think about what we're learning. And recent developments in technology give us the opportunity to do that. And that's why we're having this event today. In terms of collaboration and the theme, we know that it's a really important one. It's a really important theme in public services. We know about the benefits of it. We all have experience of it. And I think over the last couple of months, we've all seen some fantastic examples of collaboration and the benefits. But we know that it's hard as well. And that in the aftermath, or as we come out of this crisis, that collaboration will probably be a stronger feature or be more important in terms of how we work. So whether that's across sectors, across agencies, across disciplines, or indeed across jurisdictions and countries. So we've invited our three contributors to really share their experience of collaboration, so that real life experience of collaboration, and some reflections on how the impact that the current crisis is having on collaboration, and some thoughts or reflections on what's useful for us to think about as we come out of the current crisis. So before we get into that, we would like to hear from you, and we are going to run a couple of polls. We're going to ask you to take part in a couple of polls. The first one, I'm going to ask Katrina to show you the first poll, the first question. So you'll see this on your screen, but if you don't, I'm going to read the question out anyways. So the question is, what do you think is the most important factor for successful collaboration? And you've got a number of options there. So click on trust if you think that's the most important. Is it a shared vision? Is it funding? Is it structures or fora to enable collaboration? Is it open communication? Or finally, if none of those answers, if none of those accurately reflect your view, then feel free to use the chat box to suggest another answer that you think is more appropriate. So we'll just give people just a minute just to complete that poll. Okay, so we are seeing that trust seems to be the most important. you want to end the polling, Katrina, and we see what, or are people still taking part?
Yeah, I can end it there. That's nearly everyone.
Perfect. Yeah. So it's open communication is the most successful, closely followed by trust and a shared vision. So that's really interesting. Funny that nobody mentioned funding. Okay, so we're going to, I think, move into the second poll. We've got a second question for you, which Katrina is going to show us now. So how important is collaboration in your current role? So the first answer is that it's an integral part of your role. Is it a regular part of your role? Does your role rarely require collaboration? Or again, if there's something else, if you feel that none of those statements accurately describes your response, just feel free to include it within the chat. Okay. So we can see that for most people, collaboration is an integral part of my role. So we've got a huge number of collaborators here. So it'll be really interesting to hear your feedback and thoughts on the session at the end of the session. So we're going to run the last poll now, Katrina, which is third and final question. How do you think the current crisis has changed collaboration for you? So that's for you personally or for your organization. Is it having a negative impact on collaboration? Do you think it's encouraging greater collaboration? Does it offer opportunities to enhance collaboration in the future? Or do you think it's had little impact on collaboration? And again, you can feel free to write another response or comment within the chat. Okay. So the current crisis is encouraging greater collaboration and offers opportunities to enhance collaboration in the future. So that's, I think, quite an optimistic and quite a hopeful sense in the room, which is interesting. So I just want to, we're going to move on maybe from, thanks very much for taking part in those polls. And I'm going to talk to you a little bit about the three contributors before I hand over to them. So just to mention Anne McMurray. So Anne is an independent organisational development consultant. Anne is based in Belfast and she specialises in leadership and team development, strategy formulation and change implementation. Our second speaker will be Colma, and Colma is the National Coordinator of Children and Young People Services Committees. This is a network of 27 county-based interagency committees, and they support collaborative working across services for children and young people under the age of 24. They've been around now for over 10 years, and they bring organisations together in their county to plan and coordinate services, which are all about supporting the well-being of children and young people. And prior to this work, Colma has also significant experience in the community and voluntary sector, where her role involved supporting interagency working. And she's a believer in interagency working and believes that when it's done well, it works and it makes a difference. And then our final speaker is Vivian Gearan. So Vivian is a former head of the Irish Probation Service, and he retired at the end of 2019. The probation service is an agency of the Department of Justice and Equality. So in that role, Vivian led over 400 staff, providing offender assessment and supervision programs in the community and in custody. He's active at a European level. For example, he represents Ireland on the International Penal and Penitentiary Foundation. And he's also a member of the board of the Anna Liffey Drug Project. And Vivian is a champion for evidence-based service delivery and interagency working, and for better outcomes in the criminal justice system. So again, I'd like to thank our three contributors, and I'm going to invite Anne to talk to us without any further ado. Thanks, Anne.
Okay, good afternoon, everybody. Thanks, Niamh. Niamh has sent us 3 questions to help us sort of orientate this afternoon's input. So I hope to talk for about the next 8 minutes or so. And I just wanted to start off by saying that I'm sure you've all heard the phrase over the last few weeks, together we can get through this. And I suppose that's really been the watchword since the crisis, as we're calling it, actually started. And it's helped me to realize over the last few weeks that possibly a crisis is the best time to actually drive collaboration. And that's because it creates the right conditions for us. First of all, it poses a unifying threat to our survival, and that unites people together. It also generates a sense of urgency and a sense of energy that we need to move now and get things done. And then thirdly, it unfreezes our institutional positions, our policies and procedures, because we have to make rapid adaptations to how we do our business. I'd want to say though, prior to this, I probably would have said there are 3 other really important drivers. Number 1 is money, and it was interesting that funding didn't come up in the poll. But someone many years ago once described partnership working to me as the suppression of mutual loathing in order to get money. Now, to my experience, that kind of partnership or collaboration rarely lasts very long. But 2 other factors for me are really important in collaboration. One is the wow factor, that we get together to do things because it represents some passion or ambition or dream or idea that we want to achieve. Or also, and as well as, is the feel-good factor. We collaborate because actually we like each other, we've got compatible values, and actually we enjoy doing work together. And I've had the fortune to work with people and work in collaborations where that's been a driver for what we've done. In my work, probably since the 1990s, I've worked in lots of collaborations. It is integral to the way I work. My work tends to be informed by complexity thinking, which really focuses in on trying to make those changes and to do with issues which actually no single agency or organization can do on their own. So whether that's working for opportunities, better opportunities for adults with learning disability, for example, in terms of employment, transport, etc., domestic violence, homelessness, youth justice, or children's outcomes committees, those have all been sorts of initiatives that I've been involved in. Also, a really brilliant initiative collaboration for a number of years was through the Institute of Public Health in Ireland, which brought together over 130 leaders from all sectors on a 5-year leadership programme to initiate collaborative working. And that did make a massive change, I believe, based on the feedback that people have told me in terms of building trust. But I suppose the example that I'm most personally involved in at the minute is the Connswater Community Greenway, which really was a crazy dream that some of us had about 15 years ago, to create a linear park from Belfast Lough to the Craigie Hills. And long story short, we were able to get £40 million to invest in that initiative, which has created 16 kilometres of walkway greenway, and which is making a genuine impact on economic, environmental, and very importantly, social benefit in the area. And I suppose the lessons learned from that particular collaboration was the fact that we did have a compelling vision, that we had shared aims, but we also had determination to overcome obstacles such as land assembly, great selling ability because we sold an idea, we sold a dream to funders because through our imagination we were able to capture that. And also strong community engagement, the equalisation of power between government agencies, local councils and local community organisations. And I suppose finally just good governance, good accountability and rigorous attention to delivering the dream and doing it in a good way. But coming to the present time then, and COVID-19, in my view, is becoming the century game changer in regard to collaboration. Over the last number of years, a lot of my work's been around what we've called transformation, whether that's been in local government, the reform of public administration here in the north, transformation in health and social services, transformation in education, housing, agriculture and environment. And the experiences in those efforts have been that it's been difficult, it's been drawn out, and progress has been disappointing. And yet, what we have seen in the last few weeks is truly remarkable because the current crisis generated by a global pandemic has, at two levels, I've noticed significant improvement in collaboration. One, I suppose, was pointed out to me by Emily Logan, who I know is in the webinar today, but just the high level of social collaboration that we're noticing at the minute, where we have whole populations who are voluntarily complying with the restriction of their civil liberties. Okay, there's legislation around that, but there hasn't been the level of unrest that I think I might have anticipated a few weeks ago. And that's because there is a compelling moral case. It's appealing to the values that people have about protecting our health service, but also about protecting our families and our communities. So it's making a strong, both a strong emotional appeal, but also a strong logical appeal in terms of the science behind the strategies that are currently being used in public health. And what, as a result of that, what I've also seen, and certainly in the north across a number of institutions, is that the crisis is accelerating collaboration. So we've begun to see rapid adaptation in terms of things like role rotation, redeployment in agriculture, for example, agriculture department, health, rapid recruitment, flexible working arrangements, rapid use of technology. Absolutely everybody is Zooming and wearing their Zoom suits. Faster decisions around workloads, about prioritization, principle of subsidiarity, pushing decision-making down to the closest possible point of delivery because we haven't time for decisions to go back up and down hierarchies. And also what we're seeing is partnering between business, government and consumers to ensure things like food supply, medicine supply, and civic life being managed in a very disciplined and orderly way given the crisis that we face. And I suppose finally, just the reliance on local networks. In my own area, I'm part of a neighbourhood network and social media where people are sharing information, sharing where you can buy dried yeast in a much more rapid way than we could if we were relying on public services. So that said, we see lots of evidence of rapid collaboration. But I suppose the challenge is, what will be the legacy of this pandemic? People are talking at the minute about the need to provide relief, and that's what we need to do in a crisis, is immediate relief. We're beginning to think about recovery and exit strategy. But there's no doubt that this crisis will have left a structural legacy in regard to changes to the economy, to our demographics, to our environmental resources, to the educational and emotional impact on children and young people. There's no question this will have left an emotional legacy for families and communities. And even practical things like how we design housing that shapes people's lifestyles. It has also highlighted inequalities in a significant way. While on the one hand we say the pandemic equalizes us all, it also has highlighted the inequalities in people's experience. So in hindsight, when we get to some point in the future, we'll be able to assess how our leaders have behaved and reevaluate how our economy and society is structured. And And I suppose the final things then I'd want to say is what we should learn and how we should emerge from the crisis in the light of that. I suppose 3 things I'd want to say. First of all, that in crisis situations, we have to learn fast. That's the key to survival. And I think that has been demonstrated. But at the same time, we need to put a priority and a value on thinking and reflecting as work, as the work of leadership. As we think our way out of this, we think about what, if we want to test the resilience of any system, we put it under pressure. And our systems have been tested, and we need time now to think about what did the crisis reveal in terms of our vulnerabilities, because there will be future crises. One coming right down the road that we haven't talked about since it started really is the climate one, obviously. The second one is the greatest value through collaboration is connectivity. If we didn't put any more money into anything, we would generate more value just by connecting better what's broken, what's fragmented, what's disconnected. And the crisis has shown when we join things up, we create value, we create better services. And then finally, and I suppose this is something I think must change, that if we want to increase collaboration, we need to change what gets measured. And I've been wondering how the public audit committees in both Ireland, North and South, and the UK will actually do auditing of how the public sector behaved during the crisis. And there's a strong need to measure and audit collaboration and the intangible things that we can't measure, like cooperation, trust, goodwill, hope, and ambition. So I suppose those are the main things I want to say at this stage. I don't know if I've gone over my 8 minutes. Apologies if I have, but I'll hand back to you, Niamh.
That's great, Anne. Thanks very much for that. Some very interesting ideas there. I think that idea of accelerated collaboration and what we've been experiencing, the idea of the legacy and how we deal with that, and the importance of connection and keeping that and what gets measured. So just, I see some people including some questions and comments in the chat box. So just to encourage you, if you have a question for Anne, just to do that. We'll come back to, we'll open up questions to the floor once we've heard from all 3 speakers, but please do feel free to use that. And I'm going to introduce our next speaker, which is Colma. Hi, Colma. And Colma's mic is muted. I need to unmute her. There you go. There you go.
Thanks very much, Niamh. Thanks very much, Anne. Very interesting. Thanks, CES, for inviting me to make a contribution today. And I suppose just to start off by saying that my contribution is firmly in the space of a reflective practitioner, and the practice that I'm referring to today is that of collaboration. And that's because in my role as National Coordinator for Children, Young People Services Committees, I have oversight of a national initiative that was expressly designed to initiate and support interagency working, including collaboration across multiple services, sectors and organisations. So I suppose that's my day-to-day business, if you like, in terms of collaboration. And I'm also the implementation lead of a dispersed network of very skilled staff working locally to drive and support that collaboration. So I suppose I have a particular understanding of collaboration in that context, and I draw from Himmelman. So it's around it being a process for organisations to exchange information, alter activities, share resources, and enhance each other's capacity for mutual benefit and a common purpose. So it's quite long-winded in terms of that definition for sharing risks, responsibilities and rewards, but I suppose there is a context for me in terms of how I see collaboration, or how through the work we see collaboration. I'm also part of the commissioning team in TUSLA. And one of the key principles of TUSLA's commissioning strategy is a partnership approach, and that envisages the inclusion of all actors in the process of identifying need, designing services and evaluating. So I really draw on those 2 sort of parts of my working life in terms of the contribution. I think broadly speaking, across many of our workplaces, this interagency type of work, it's not always perceived as being core business, or maybe it's seen as an add-on or just nice to have, or other work. I would say though, it is, however, deliberate, structured, iterative interagency collaboration. It has a shape, it has a form, it has a methodology, it has a purpose, and it's very much real work and essential to an evidence-informed practice. So when our public health emergency landed, a steadying of the ship was really needed in terms of that collaborative workspace in which I inhabit. Everyone's attention, absolutely understandably, was drawn inwards to establish remote working, to establish who was available for work and what gaps were emerging in our own organisation's provision. And in that scramble, to make sense of our circumstances, inevitably thoughts regarding what should we cut back on, where can we cut back, took place. So was maintaining collaborative interagency working through existing structures viewed as core? So staff in our collaborative roles needed immediate support to listen, to hear what their experiences were across the dispersed settings that they were working in across Ireland, and help them to make sense of the changes happening around them, and to clarify with them how the work still made sense and was needed. So maybe there's a tendency in a crisis to think about new contexts, we need new conditions, we need new infrastructure, we need new tools, when in fact sometimes, in some cases, we were well placed to mobilise through our interagency mechanisms and collaborative systems already in place. Now, I'm not saying everything was perfect, I'm just saying that I suppose that investment that we had already made was there and ready for us to use. And this enabled staff and partners, particularly our community and voluntary sector partners, to stand up specific emergency responses, urgent needs for children and families, such as food provision. So children who on a daily basis were attending early year services or schools that were no longer able to access those services and maybe were receiving food support due to closures, they were no longer, getting that support. So there was a real opportunity there and a real drive and a real actual delivery in terms of that kind of food provision, collaborative work around that to make sure that that happened. Other collaborative efforts included education supports, hard copy materials into homes where there was no digital capacity and where services have had to close, and play resources too. And all of that was with the intention to support children's well-being in the now, and in the now being constrained family life. So equally, some families have become newly unemployed and they're now without the means to sustain themselves without additional support. So families who might not necessarily have been on a social service caseload or needing intervention in the normal course of events. So again, having that kind of local connection and those relationships already established is very crucial. Our interagency structure as a sort of a core business would ordinarily be coordinating information across multiple agencies and sharing and promoting that in the interest of reducing duplication and promoting good planning and joint planning. And I suppose in those areas where we were sufficiently connected up, that local intelligence, we were able to build on that when we all ended up having to go remote, and that we were able to establish what services are operating, how those services are operating, curate that information and disseminate it rapidly. And equally, I suppose that intelligence, as we call it, that local intel, it was able to help around emerging needs of families, as I mentioned. And these types of, I suppose, pieces of intel, they are informing national collaborative working in shaping emergency funds and information campaigns. So we are contributing up as well as contributing locally. I suppose I want to consider now just briefly, I suppose, what does collaboration look like and whether does it look different in a crisis, or are the fundamentals still the same? In this current crisis, the operating context has clearly changed and operations are still happening and adhering to public health guidelines and being managed tightly and with caution. And more broadly, technology has been harnessed. But as we go into the weeks and the months ahead, we will certainly need to collaborate more with an even more of a focus on enhancing each other's capacity, which is part of Himmelman's definition of collaboration in terms of that willingness, not just to look after our own organisation, but to enhance another organisation's capacity as well and our collective. And smaller services, providing those key supports to the very vulnerable groups in society, they may need a greater share of the resources available in the longer term to adapt how they were providing. They're doing stellar work at the moment, and it's a crucial partner. The challenges, time, data, power sharing, these apply in ordinary times. Nowadays, it takes time to build a relationship of trust, and we might not have that time. It might need a leap of faith, and returning again to Himmelman, a leap of faith to share risk, responsibility and reward. Our data systems are generally poor in a broad sense. Work is in progress. We continue to develop a culture of using data to inform our work, and having those collaborative systems in place already can help in a time of urgency to get the type of data that we need from the ground up. And then there's the power sharing and sharing credit. It's generally a challenge, I think, and territoriality is a feature now as ever. So have I answered my own question yet? Does the act of collaboration look any different in a crisis? I think I'm going to let you decide on that one. I do think a collaborative approach remains relevant, and I believe it is a virtuous cycle. Collaboration breeds collaboration. So we need to nurture our interagency structures in the good times and in the bad times so that they are ready for the highs and lows, and we are ready, and the actions can be taken swiftly when needed and progressively when needed. So ultimately, I am talking about people like you, people like me, delivering a piece of the service landscape, being included and feeling included, and not being excluded on the basis of somebody's idea of expediency or efficiency. So I think maybe just, I suppose, the other thing to try and remember is our service users and how we continue to keep them connected, particularly with the digital divide going on. I'm saying, I suppose the saying that nothing about me without me is very salient here, I think. So I suppose I wanted to reflect very quickly then on just the type of person who's a collaborator and what makes an effective collaborator. And really, I suppose, to say that the people who participate, they can make or break a collaboration. So how do you know if you are one? And how do you recognize good collaboration? So maybe the literature might say that, similar to the literature on leadership, that you know, is it a pure innate trait? No, it can be developed. Like the literature on leadership tells us, that leadership can be developed. And it combines interpersonal skills, personal attributes, and technical skills. And it's not about the most charismatic person in the room. You need your technical skills as well, like project management, time management, subject expertise. And they're all incredibly important, as well as your personal attributes about being patient and open-minded and diplomatic, having good communication skills, listening, and the ability to work, and being good at groups and process. And the common thread through all of this is people skills. So in conclusion, as we emerge from the crisis, I think we need to consider giving attention and time to nurturing collaboratives regularly and systematically. It is a strategic practice, and it bears dividends in the main and can bear dividends in the time of crisis. A feature of crisis might be to discard some of the good stuff and default to what we've already done and retrench into our own service. I say don't. Collaborative structures support information share, and this can support stronger decision making and better design of emergency responses. It needs responsiveness from you. Answer your emails, make the call, attend the meeting, and be present. Presenteeism doesn't cut it in a collaboration. Are you truly collaborating if you're not contributing outside of the meeting or acting on behalf of the collaboration? Of course, sometimes collaboration is not the answer. Command and control might be appropriate in an emergency. And I just finally, in terms of thinking about you, if you end up in the role as that collaborator or leading a collaboration, it can be really rewarding. However, it can be a lonely space and tricky to manage group dynamics. You do need skills to keep people on board and to move the talk and ideas to action. And you need to be able to recognize that not everyone likes everyone else, and not everyone likes you. It's not a popularity contest. Neither is it the convener of the collaboration sole responsibility to make it work. We can all be responsible for our own contributions, crisis or no crisis. Thank you.
Thanks very much, Colma. That's a really interesting input. I'm struck by a couple of things that you said. Just that definition, which I think is really interesting. So it being a process which enhances capacity for mutual benefit. And also your points about the investment in developing infrastructure, because quite often we know about the amount of time it takes to build relationships, good working relationships, and that actually, you know, it's only when it comes to times like this that you really see the value in doing that, or it really brings it to the fore. So again, I see some people making comments and asking some questions in the chat, and just to encourage you to continue to do that as I hand over to our next speaker, which is Vivian.
Okay, thanks very much, Niamh. Virtually all my direct experience of collaboration has been within the criminal justice sector, and specifically in offender rehabilitation. And those examples include interagency programs for the joint management of offenders, including those that prioritize high risk and prolific offenders, for example, as well as sexual offenders, women, young people, and also work with victims of crime and restorative justice programs. Coming from a baseline of relatively little collaboration historically, as we know it, in the criminal justice system, the really big changes, I think, came about when leaders at the most senior level in organizations saw the value of working together on shared goals in a strategic way and facilitated relevant people in their organizations to make that happen. Key drivers are facilitated in that context included a strategic review of penal policy published in 2014, which gave government and ministerial and departmental imprimatur to collaboration. Also, the involvement in a coordination role by the Department of Justice and Equality was crucial, and that role was further enhanced by the reorganisation recently of the Department of Justice and Equality, which facilitates a more finely tuned focus on the coordination of policy and service delivery. And finally, the relatively recently created Criminal Justice Strategic Committee, comprising the heads of all the criminal justice agencies and chaired by the department's Deputy Secretary General, has been crucial. Having said all that, real and effective collaboration, in my experience, at interagency level is not easy. It's often difficult, and it doesn't just happen by chance. It takes effort and commitment and follow through. Our default position, our comfort zone, unfortunately, tends to be our own silo. And what enables collaboration to happen, I believe, at the frontline interagency context can include the co-location of staff from different agencies working together, as has the joint training of staff from different organizations developing a shared language and understanding, as well as shared approaches to interventions and so on. So sometimes collaboration took a long time to develop. And in that context, I believe it was always essential to have the resilience and perseverance that was needed to achieve the end goal. Our most recent experience in the context of the current crisis also shows that in such a crisis, collaboration is also possible to achieve virtually overnight, if not instantly, when it needs to be done. On the face of it, government departments, statutory agencies, as well as non-governmental organisations and the wider community have never cooperated more closely than they are at present in response to COVID-19. I don't want to take from that because the level of collaboration and its impact has been massively positive. I do believe, though, and I don't want to sound alarmist, that to some extent we are in the middle of the easy part of all of this right now. I believe it will be even more challenging for how individual organisations respond and how they collaborate together as we move into times of less restrictions and ultimately and hopefully a return to something approaching normality. So what do we learn from past experience about collaboration for the present and the future? Excuse me. First of all, I believe that leadership is always important. So is identifying shared goals that we can all agree on, commit to, and act on. I also believe it's important in general to put down the shared plan in writing and literally sign up to it, that's critical. And the issue of resources has been mentioned. I've always believed that while resources are important, they are not the most important ingredient for collaboration to happen. By that I mean, for example, that resources, including money, are insufficient in themselves to achieve collaboration. There's a huge importance, as I've mentioned, for leadership at all levels, including political leadership and support, as well as support at the most senior level in central government departments and their agencies. The current crisis has given a huge opportunity for people at all levels within different organizations to demonstrate their leadership and their commitment, as well as innovation. And I see that now through my involvement with addiction organizations such as the Anna Liffey Drug Project, where staff are just being incredibly committed and creative in their positive response to the needs of service users and what is being asked of them as workers. And I know that the same applies in organizations across the board. So in terms of looking to the future, what we might learn and what we should hold on to, first of all, I think that anything is possible, that working together we can achieve literally anything. Secondly, the power of the individual person, the individual citizen, in working together to keep all of us safe and alive. And thirdly, the importance of data, information, evaluation, and research. What has been referred to frequently in recent weeks in the current crisis as the importance of listening to and heeding science. I do believe that the current crisis provides ultimately a massive window of opportunity for positive change in the future. We need to ensure that there is and will be an energy to learn from the lessons of the COVID-19 crisis, and not only learn from it, but build on that learning into the future. And while we've all been understandably focused on making the technical changes needed and required of us in the here and now just to survive, I believe that we also need to set aside time and space right now to discuss the impact of the changes that are currently having, and the changes that we want to stick in the longer term, and those that we don't, and those further changes that we want to implement in the post-COVID-19 landscape and culture of our organizations. For some of us, I think when we come to the other side, it might feel like the crisis is over and we just need to get things back as they were before. This may even include some element of crisis or survivor fatigue or even apathy. And it's important that organizations, and specifically their leaders, see beyond that potential inertia and stagnation to a new and better future of collaboration. So in terms of looking as to what might happen next, where do we go from here? I do expect, as has been mentioned already, that money and other resources will be a challenge post-COVID-19. Having said that, I do fundamentally believe that innovation and collaboration is always possible, and we shouldn't make money an excuse. In practical terms, I think we're at a stage of the formation of a new government. I do believe that the upcoming programme for government that will need to be developed, and the new departmental strategic plans, as well as thematic strategic plans, will provide one set of practical opportunities for organisations to develop collaboration further at a structural level. New and even better collaborative relationships and structures that may have developed or begun to develop during the crisis should be maintained and further developed. And now is probably the time really to build those relationships and structures for the future. We do need, as was mentioned already, to create space for reflection, for discussion, for the development of innovation. And we need to do that right now through events such as this one organised by the CES. And just to finish, if I could mangle one particular metaphor to conclude, that we may need to throw out a lot of bathwater after the current crisis, but let's be particularly discerning or choosy about the babies in that water that we want to save, or equally those that we may want to throw out. Thank you very much.
Thanks, Vivian. Thanks for that. So I'm actually just realizing that time is up against us. So I want to really look at the comments and some of the questions that have been coming in on the chat box. And there are some interesting, there's an interesting thread here just about how I suppose the crisis has, created this momentum around collaboration, but actually, how do we sustain energy to continue that when the crisis passes, and making sure that we don't revert back into working in silos. Another one about how do we integrate it and make it business as usual within our organizations. Examples of new efficiencies. So we've seen some of the examples that we have seen, and there are specific examples in health that are being mentioned. But how do we capture those and hold on to them in future. And we have, I'm just looking back here now, so bear with me. The importance of investing in capacity building. If there is a lack of capacity building, then sharing risk, responsibility, and reward can be imbalanced and can damage relationships. So, I mean, coming back to that general point about sustainability then, anybody like to come in at that point, Anne, just about how we make it business as usual?
I'm not sure I've got the answer to that, but a couple of things. Just really great to see all the comments, and maybe when this is over, we'll have a 2-day residential somewhere in Neve and really get a chance to talk about all of this. I think that the pandemic is a wake-up call, because in a way we've got a paradox here. Globalization hasn't worked for us. Globalization has been exposed through this crisis as things like with the competition for scarce resources like PPE. Okay, smaller countries can't bid for those, and yet we're going to need globalization to deal with things like the climate crisis. For me, I think this is highlighting the need that through the 21st century we may need a different modus operandi entirely, and it's going to be important for governments, for industry leaders, for public sector leaders to actually step up and reimagineer how we need to develop our institutions. And back to what I said about measurement, I think we need to measure and incentivize in different ways. And also finally, just to say the importance of local and strengthening local systems so that when things like this happen, they're not subjugated to the collapse of bigger systems.
Okay, great. Anybody else? Colma?
I guess, so collaboration obviously isn't new, we all know that, but maybe as Anne has already said, is it rewarded or is it recognised? And certainly introducing incrementally, maybe measures through, you know, from our parent departments into our services, you know, incrementally introducing measures to capture small amounts of data around whether people are working or collaborating and recognising it, I think. So not coming down with a hammer and saying you must, because again, presenteeism doesn't help if somebody just has to sit on a committee because they're made to sit on a committee. But like recognising that partnerships and collaboration are actually important and a key part of people's work. One way of doing that is for parent departments and funding departments to maybe just ask for some sort of data back up the food chain on that. And the other thing I think is as well is I mean, not wishing to sound too trite or whatever, but you know, we are all you know, in charge of our own behaviour, and we can all be champions in our own organisations for collaboration and for reaching out and being curious and asking other people for their opinion and sharing, I suppose, some of our resources.
Great, thank you. Vivian, any thoughts on that, on sustainability and how we keep it going?
Yeah, I do believe, first of all, as I said, that the really important thing is to pay attention to that now. I think there's always a danger in a crisis of just dealing with the crisis, doing what needs to be done to fight the fire, and that's absolutely essential. But the first necessity is to pay attention to what's going on. What are the good elements of it and the bits that we might want to leave behind. I also think that it'll be different for each organisation and each sector. So while there will be similarities, and there are similarities and comparabilities, each organisation and each sector, whether it's health or education or criminal justice or whatever, will have a different slant and a different need within all of that. So I do think, going back to the first point is to pay attention to what's currently happening, what we're all doing that's working, what won't serve us well in the longer term, and that we might need to change. And I do think ultimately that the answer to all of those questions is within as Colma referenced, I think as well, is within all of us individually and within our individual organizations and sectors.
So we all have a part to play in it, really. Just to mention also a couple of other comments. So we have one here, interesting that the COVID-19 crisis, much collaboration requires the long road, and a fear that support of the goal is starting to fracture as public patience and political unity is not maintained. So any advice on strategies that might address this? And we also have an earlier question that I missed here, which is really specifically directed to Colma and Anne. And very interested in work that's being done to involve parents and parent carers of children and young people with disabilities in Northern Ireland and Republican Ireland and the Republic, in collaboration with local community and voluntary organisations. So if there's anything that either of you want to make a comment there, we can also connect up people outside of this conversation if that is more helpful.
Yeah, I mean, just very briefly, I certainly don't have the answers to everything. I'm happy to connect with somebody afterwards. There are certain parts of the country that have really put a focus in terms of children and young people services committees on children and young people with disabilities and that. And so I can certainly share that information afterwards. I'm thinking specifically of Waterford and Donegal and Kerry and that. So, I mean, obviously some work there, lots more to do, absolutely lots more to do. Need is great across many, many different sectors. But yeah, happy to follow up on that need later.
Okay.
Can I just say one thing, and then it'd be really great to hear from other people, but just one of the things that I've been encouraging some of the organisations that I work with is that they capture and record observations, ideas, insights as we go through this, because now is not the time to design the future. We have to get beyond this phase, but it would be good to have a record of what we thought and experienced as we go through it, to actually do some sense making beyond the crisis itself, so that, as Vivian said and Colm was pointing out, we can discern what was important to hold on to, but what we must let go. Because in some ways we need third order change. We need to create new institutions and new ways of working and involve all of those voices, diverse voices, in helping to shape that.
Yeah, and I suppose on a similar theme, there's a question here about, you know, what's the best way for us to capture that learning? You know, what ways can we do that? Like it's interesting even to think, you know, the impact of something like physical distancing, when we're so used to meeting up either formally or less formally, and those accidental conversations and meetings and how important they are sometimes to collaboration. Now we're working online, and you know, does that kind of lack of physical connection, does that have an impact on how we're collaborating? Anybody? For the better, for the worse?
I think in terms of that physical connection, again, to some extent, there's a possibility of being seduced by the, you know, what technology has had to offer us, for example. But certainly in the world that I've worked in all my life, while technology can assist, you know, the personal contact is essential. The services that social work, whether, you know, it's child protection or criminal justice social work or whatever, has to offer, is fundamentally about a person-to-person professional relationship and what happens there. As I say, I think technology can assist that, but you know, it would be really dangerous to assume that we can lose the, you know, the essence of that helping relationship into the future. We might be able to scale it back. We might be able to put it asleep to some extent for a limited period of time, but we can't eliminate it. And
just to add to what Vivian's saying there, that someone said to me recently that one of the things this experience is perhaps revealing to us, that what in the past we called inefficiency was actually building resilience in organizations, which means the time we would spend thinking, talking, researching, understanding, a lot of those activities have been cut out of organizational life under the banner of being more efficient, which therefore means when the pressure comes on, we don't have the capacity, not just, I think we have the capacity at the minute to respond, but it's the longer term sustainability to be able to endure it and design something at the end of this that is based on the learning from the experience and resetting how we do things rather than simply restoring the way things were before.
Yeah. So we're actually coming up to 5 o'clock. So I'd like to invite our 3 contributors to make any final comments here before we draw this session to a close. Colma, any final thoughts on what you've heard or reflections on what you've heard today?
No, I mean, I just want to thank people for joining in, and I suppose I would a call to action to become a champion for collaboration really it would be my parting message. I don't want to be remote forever. I agree with Vivian that there's so many key services in mental health and in other places in education. We need to be able to interact, but be a champion for collaboration. And thanks for listening. Great.
Anne, any final comments?
Just that I think that what will make us sustainable and successful in the future are the assets that we can't measure so easily. Things like creativity, imagination, hope, compassion, and the qualities that make us human beings. But those are the things that we're going to need as we go through into the 21st century.
And Vivian?
Yeah, just a couple of quick points. First of all, to pick up on one of the earlier points that Anne made, in terms of making sense of this crisis going forward and how we capture and record what's happening. I think there are a number of ways that can be done. Some of that, in actual fact, can be helped by technology. And I'm conscious, certainly in the drugs and criminal justice area, that some of that is happening at an international level, which I think we shouldn't lose sight of as well, that we can learn so much, not just from each other within our own country, but also internationally. The second point is, I think we need to be always aware, you mentioned, Niamh, about the some evidence that support can begin to fracture for how we're responding to the current crisis, and that makes me think of the fragility of collaboration, that it's really powerful, and at the same time it can be quite fragile if we don't mind it and we don't invest in it. Which leads me into the final point, which is the one made by Colma, that I think going forward, we individually all need to be champions for collaboration into the future.
Okay, thank you very much, Vivian. So so thanks to the 3 of you. I think it's been a really interesting, thought-provoking conversation. As I said, we'll have a recording of it, which we'll make available. At this point, we've got a final poll for you, which is that if we're to organise another event like this, we'd be really interested in hearing your ideas or thoughts on the kind of topics that you'd like covered. So I think, Katrina, you're going to pull up a final poll. So which of the following topics would be of interest to you over the weeks ahead if we were to organise another theme? So we have getting in evidence into practice, implementation, practical approaches to evaluation, using digital tools, and other. Again, feel free to put in to write in other examples into the chat box. And to say thanks very much for your participation. As I said, this was our first event like this, so I really appreciate you taking the time out to join us. If you'd like to keep in touch in terms of future similar events, just visit our website and you can sign up to our mailing list, and we'll circulate details of the next session that we will run, which will hopefully be soon enough. And we can see that there is a lot of interest in implementation, kind of fairly across the board for all of them. So, but definitely implementation and getting evidence into practice. So that just provides us with a few ideas. And let's see what also we have in the chat. Creative approaches to engaging people using services and frontline staff during a crisis. So listen, that's great. It's been a really enjoyable hour. Thank you very much. We'll be in touch with the recording, and in the meantime, I'm wishing you the very best and hope you're staying safe, and you and your families are staying safe, and we look forward to seeing you again here soon.
Thank you very
Thanks
much.
very much.
Thank you.